So welcome everyone. Today we will be seeing in care note on the communicable disease for the pneumonia. Okay. First concern patient history, in which we have to write the patient identification like name of the patient, age of the patient, CR number, MRD number, which is available on the file of the patient, the unit, the ward in which the patient is admitted, bed number, the department. For example, if the patient is from medicine or the surgery, and then so on, you can say in that. Then comes in chief complaint, which means that what problems do the patient is having. For example, patient is of a lung problem, then he will have a breathlessness, headache, fever, etc. See, then comes an history part. First, present history, in which we had to write the present condition of the patient. For example, the complaints which he is having like breathlessness, cough, fatigue, and what he is diagnosed with. For example, pneumonia. Then comes in past history. In past history, we will write for if the patient was diagnosed with any other condition in the past, any comorbidities like diabetes mellitus, hypertension, thyroid, or anything like anything, TB. Then comes in present surgical history. For example, if the patient is having any surgery like vasectomy, appendectomy, or any past surgery. For example, again, vasectomy and appendectomy. If he is not, then we will write that he do not have any past or present surgical history. Then comes some family history, like the family is having any history of an chronic problem like respiratory problem, cancer, TB, or anything like that. Then comes in family composition, like how many members he is having in a family. For example, 4 to 5 members, a nuclear family. Then we will make a chart in which we will write the names of the family members and their education, their occupation, what is their age, what the relation of the person with the patient, and then their health status. Then comes a family tree, in which we have to make a tree of that family. The male means the female means in circle, that means in cross, and an arrow is indicating a patient. So I didn't add an arrow to the Rajesh, but there should be. So see, the Shamrav and the Ashabai are the parents of an Rajesh. The Pradna is her wife, and then Anjali is her daughter. Then comes in personal history. In personal history, we have write their habits about like hygiene, their smoking habits, like if the person is addicted to an alcohol, smoking, or anything like that. Then their sleep history, like the sleeping hours they are getting like 4 to 6 hours or not. Then their diet history, if the patient is vegetarian, non-vegetarian, or the mixed. Then comes on the nutritional history. So see, and again, if the patient is having her diet or not, if the patient is vegetarian, non-vegetarian, his appetite is reduced due to illness, what is her fluid intake or food intake, and their output also. And then comes in socio-economic history, in which we have to write the class of the family, like middle class, high class, low class, their income per year, for example 30,000. Then comes an environmental history, in which we have to write the area in which the patient lives, like urban, or he lives in a city. And in the last comes in psychological history, in which we have to write if the patient is conscious, oriented to time, place, location, or not, if the patient is cooperative, or is having any problem. Then comes a medication chart, in which we have to write the medications, their name, dose, route, frequency, and action. Like all these are given in the file of the patient or the page of the patient. Then comes an investigation, like we have to first write the parameter, the normal value, the patient finding, and the enough if it is increased or decreased. Then comes some physical examination, within which contains some general appearance, vital signs, mental status, which you can see, and then it starts an integumentary system. So see, I'm not explaining it in detail. If you want, then I can make another for that. So in common skin, the vascularity, texture, skin, color. Then come in nail, in comes in shape, color, texture. Then hair and scalp, having a dandruff or the color of the hairs. Then comes in head and neck, like the shape of the head is normal, if the face is pale, the fatigue is shown or not, and eyebrows, eyes, if there is having an infection, so we will see a vision of that person if it is having any vision problems or not. Then ear, if the hearing of that person is normal, who is having an infection in that ear or the nose, or it's deviated or not, there is blockage, like if the person is having a cold, then it might be. Then comes on mouth, we will see lip if they are dry or dull, sinuses is present. Then comes on teeth if they are white or odor like a foul smell. Then tongue if it's pink, sometimes whitish. We will see a neck if the thyroid gland is enlarged or not. The range of motion if the neck is having a pain while moving. Then chest, we will see an expansion of the chest. Then the use of the accessory muscle is done or not. Then breathing pattern, breathing sounds, etc. And then comes an abdomen, in which we will see an inspection, palpation, percussion, and the auscultation. And then last comes an back, if there is an spine deformity like then calluses or anything like that. Then in extremities, if there is an edema, pain, or swelling. In genitalia, if there is an discharge, infection, hemorrhage, anal fissure, or then comes in disease condition, in which we have to write the anatomy physiology of that disease condition. Then comes in introduction, definition, and then the types of that disease condition, like which is given here. Then comes in etiology and the clinical manifestation, in which we have to write in two columns like book picture and the patient picture. Then comes in pathophysiology and the investigation diagnostic studies. Okay, in a flow chart. Then comes in management, medical, surgical, and the nursing management. And last, on complications. We have to write the nursing diagnosis, the 5 nursing diagnoses, from which we have to explain only any three of them. Okay, so you can see I had explained the 3 of them, and I'm not explaining them. Okay, after that comes in nurses notes. Okay, you see. So you have to write only one day nurses note. You can screenshot. Then comes in health education in 5-point: diet, rest, hygiene, medication, and the follow-up. Then comes in summary, conclusion, and in the last comes in bibliography, in which we have to write the 5 books name with the author,